we don't really like to think that doctors and scientists who we respect would be at the forefront of creating a Holocaust. We certainly don't like to think that doctors and scientists in a country where every American would go to study would be at the forefront of a Holocaust. We certainly don't like to think that, in fact, the country that set up the medical education model that I know, 2 years basic science, 2 years clinical, was where the Flexner report came from, where he visited to find out how to take American medicine from a bunch of empirical quackery into modern science, was the German model. He didn't go to Britain, didn't go to Japan. Everybody who was anybody and wanted to know about science and medicine went to Germany. It's no accident that Laughlin was being paid attention to by Germans, because that connection on the science and medicine front was very direct. It's easier to explain all this if we think that the doctors and scientists involved, let's just say for the time being with the medical experiments, were kooks, cranks, nuts, crazy people. And the paradigm for this is that guy, Joseph Mengele, who probably did fit the description somewhat of kook, crank, and nut. He did do barbaric experiments in the camps. He was someone who had his own sort of personally crazy theories of biology. He practiced them on innocent victims and caused much terrible death and horror. But he is not typical at all of the people who are doing the research in the camps. In fact, it would be fair to say that no one at the time in Germany paid any attention to what Dr. Mengele did. Didn't care. They knew he was a low-level, not particularly impressive researcher, and really weren't that interested in his pet theories that he had about different biological properties of inferior races. It's hard for medical science to accept the role that the premier biomedical establishment nation of its time ran this gigantic euthanasia program, killed the disabled, and did horrific medical experiments. It's just hard to accept. It's easier to say they were all Mengeles. The Germans themselves completely whitewashed the history in the post-war era of the involvement of medicine and science. Remember I told you we did the first conference on medicine and science in 1989 when I was at the University of Minnesota. The first conference in Germany didn't take place till much later in Tübingen in about 1997. No discussions, no conferences, no nothing. Why? Because most of the people in the party of physicians and scientists were party members. Nobody dragged them into the Nazi party. They enthusiastically joined it. They saw it as a way to do what has been referred to by others as other Nazis as applied biology. And nearly all of them went back to work at the end of the war. If you were going to have a German healthcare system and science establishment, then you were going to use these people, and they all resumed their jobs. And they certainly weren't interested in having meetings about the role they played in the Holocaust. So there weren't any. Bioethics doesn't like to accept the idea that mainstream people, as I told you, would wake up and kill people in experiments and then go home, because if that's true, then what is the point of ethics? If they had ethical arguments, then what good is it to teach medical ethics? And we know, you heard a little bit from Professor Gilman, there were ethical codes, ethical restrictions on how you dealt with individual patients long before the Nazis came to power. If they're not of any use or people don't pay attention, what's the point? So in my field, we certainly aren't that interested in undermining the value of what we do. So all of these factors contribute, there are others as well, to why it's tough to look at the role of mainstream medicine and science in the medical experiments and in more generally the euthanasia activities. But now I'm just going to zero in on the medical experiments because it will make concrete the dilemma of dealing with the ethics and the ethical justifications that were given for doing these experiments. And you remember, there are many different categories of research that were done. There were a number of projects done to try and develop better ways to kill people. They were driven by cost-benefit considerations, development of gas, phosgene, many other ways to kill were done in the camps to try and find cost-effective ways to be able to kill large numbers of people. Continued interest was shown in sterilization. There were many, many studies done for military purposes. This trial of the doctors was the second trial at the end of the war. The doctors were put on trial. Brandt is in there somewhere. I think he's the first one on the bottom there. And the reason this trial took place early was three reasons. One, the smoking gun problem. It always is hard for somebody to say, well, who exactly ordered the bombing of X? Or who rounded up these Jews in this village and commanded they all be killed? But it wasn't so hard to say, because people did survive, that at Camp X, at time Y, this experiment was done, and that guy killed those people, and I survived, and I can point the finger of blame at him. So one reason to go to the doctors early was because you could make causal connections in the prosecution. Remember, this is a time where we don't really have doctrines like crimes against humanity, genocide. These things don't exist really. The prosecution is trying to develop them as legal doctrines. But still, you could put a lot of these people into the camps with people who saw them kill people. Secondly, we really don't like it when doctors and scientists do horrible things. So this sets up the prosecution to get the judges hostile about what took place for future trials. So that certainly is a factor that's on their mind. And then the third reason that the doctors are brought forward sort of rapidly is that I think the prosecution themselves were astounded at the level of evidence they could build up in terms of telling stories about what they had. So that's sort of why they're up first. These are notable defendants. You've heard a little about Brandt. I want to tell you a little about Gerhard Rose. Gerhard Rose is the antithesis of Mengele. Gerhard Rose was the head of the Koch Institute of Tropical Medicine. When the Germans invaded the Eastern Front, they had a very tough time, as many of you know, with the Red Army. You've all seen those videos about Stalingrad and supply problems out to the east. But what's not captured so well is that they were losing 4 men to every 1 killed by the Red Army to typhoid and typhus. Typhoid and typhus were plagues on the German effort to succeed on the Eastern Front. During the war, the Wehrmacht, the German army, went to Rose and said, we need you as the top infectious disease guy in the world to find a cure or a vaccine for typhus and typhoid. We will give you unlimited access to the prisoners in these camps, and you do whatever you need to do, but get us a cure. And by the way, Gerhard Rose was not a Nazi. He was just the leading expert on infectious disease in the world. Rose said, no, I can't do this. I can't give people typhus and typhoid lethal experiments. It's against my ethics. The Wehrmacht came back about 6 months later and said, here's the deal. We're losing on the Eastern Front, and we're probably losing now 6 or 7 men to typhus and typhoid. And if you don't do these experiments, then when the Russians get here, they're going to shoot you in the head just like everybody else. They're not going to distinguish between who's a party member and who isn't. You're prominent. And by the way, you owe it to your nation at a time of total war to do what it takes to win it. I don't think Dick Cheney was around at this conversation, but might have been. Gerhard Rose said yes. We'll talk about him a little more, but when you think about science and medicine, forget Mengele. Remember Gerhard Rose. Gerhard Rose is the much tougher example, the much more interesting case, the much more problematic figure, because Gerhard Rose is a good scientist, a good doctor, and he started off trying to be a good man.